Hey everybody, it's Dr. Colin Perro with North Texas Facial Plastic Surgery. Today's question we're going to answer is the difference between botulinum toxin treatments and filler treatments. This is a common question with patients that have not been treated by either to maybe misunderstand the differences or the indications between the two, but it's a relatively simple distinction. So botulinum toxin treatments include things like Botox, which is the most popular, Xeomin and Jeuveau, which is a newer one, as well as Dysport. So those are all brand names of different formulations of botulinum toxin treatments. And those are used to in a very controlled manner, preferentially paralyze muscles. So, for example, if I raise my eyebrows, there's a muscle that comes over my head and grabs my eyebrows and pulls them up. Well, in so doing, it causes the skin to be creased. And so if that happens a few 100,000 or million times, depending on your anatomy, depending on your genetics, etc., that will eventually lead to some deeper creases that can be there even at rest, not just when raising the eyebrows. And that can happen in other parts of the body as well. Obviously, talking about the face, primarily in the crow's feet area or the frown lines between the eyebrows would be the three most commonly areas treated. So if we preferentially and selectively knock out those muscles, which we can do with botulinum toxin treatments for about 3 to 4 months, then it prevents that movement and therefore prevents the overlying creasing from happening and gives you that softened appearance, less concerned, less tired, etc. Filler treatments are different. Filler treatments don't affect the muscle movement, but they do fill in low spots. So if you think about a wrinkle or a crease, it's a low spot in the skin. And if you have wrinkles or creases in the skin like this, well, the light typically comes from above and it can't get into that deep spot. And so that's what leads to the wrinkle formation itself. So in injecting a filler, you're actually taking it and smoothing it out. Then the light hits it more evenly. It doesn't look as deep. So common areas treated with filler are the nasolabial lines, which are just that between the nose and the lips or the cheeks here. The marionette lines, which are the ones kind of like a puppet, have the lines extending down from the corners of the mouth. But there are lots of other indications, both on-label and off-label, for filler uses. Both very safe, very well established in the hands of a qualified injector. Hopefully that clears up some confusion for some of you, and feel free to reach out to us at drperro.com if there's any more questions. Thanks a lot.